Great, thank you. And so, please continue to pay attention. We are in the last hour and a half, but we're going to do something a little bit different now. We're going to do a little bit of like speed dating. We're going to be doing speed talks here. We really wanted to get into a little bit more of in-depth information related to some local ordinances affecting sugar-sweetened beverages. And so we've asked our next three presenters to give really short talks, 8 to 10 minutes, to really focus their presentations. And then we're going to ask some general questions and then take questions from the audience. So we're going to begin from hearing from Margo Wootan from the Center of Science and Public Interest regarding how ordinances are shaping beverages offered in children's meals. Children's meals has been mentioned. We'll then hear from Lynn Silver of the Public Health Institute, who will discuss taxation of sugar-sweetened beverages and the use of warning labels. And then finally, we'll be hearing from Michelle Milo of Stanford Law School, who will provide insights into which ordinances are being challenged and on what legal grounds. And so with that, I'm going to pass the baton to Margo.
So we've talked about parents quite a bit. Maybe I'm going the wrong way here. There we go. And parents in focus groups and when I'm out and about around the country really tell us that they are almost solely responsible for what they feed their children. They feel a great deal of responsibility. And of course, parents play a key role, but we also know that kids are eating a lot of places where the parents aren't present. You know, we've heard about childcare in schools and aftercare programs and other places, but they don't think about that. They really feel like they are supposed to control all of their children's food choices. But even the best intentioned, most disciplined parent can't control everything their children eat, even when they're with their kids. And even when we are with our kids, our food surroundings have such a powerful influence on what behaviors children exhibit, not only what they ask us and beg us for, but what they expect to be fed. And that oftentimes parents take actions around their kids' food behaviors that run counter to what they really want to do, run counter to their intentions. So I was asked to talk about one particular place where children's diets get undermined, and that's when they're eating out. That eating out is a much bigger part of our diet than in the past for both adults and for children. Families now spend more of their food dollars out on away-from-home foods than they spend on at-home foods. For adults, it's about a third of their calories. For children, it's about a quarter of their calories. So eating out plays a different role in families' diets than it used to. Not only is eating out a big part of our diets, but it's usually a problematic part of our diets. If you look at children's diets, when they're eating out, they're worse than when they're at home. They eat more calories, more sugar drinks, more saturated fat, more sugars, fewer fruits, vegetables, and whole grains. And the differences can be quite considerable. On a day when a kid eats out at a fast food restaurant, on average, they're eating about 125 more calories. On a day when they're eating at a sit-down restaurant, they're eating about 160 more calories on average per kid per day. The other thing about restaurant food is that restaurants are the #1 food category marketed to children. So kids are bombarded with a lot of promotion for eating restaurant foods, and oftentimes that's for unhealthy foods. When kids see ads for fast food, they see a very fleeting image of, these days, if it's McDonald's and Burger King, a healthier version of the kids' meals, with apple slices or milk instead of soda or fries. But that image is so fleeting, the kids don't remember it. They remember just the message, go to McDonald's, it's fun, it'll be great. And then once they get there, what's on the menu really is the focus of the marketing. So they may see an ad for a healthier kids meal, but what really it is marketing to go to McDonald's, go to Burger King, go to Wendy's, and then what they get there, what really matters is the food that's on the menu, and for very little kids in particular, what's on the children's menu. So it's really important in terms of addressing restaurant food marketing, or food marketing overall, with restaurants being a big category, to address not only what's shown in the ad, but more importantly, what's actually on the menu, because that's what's being marketed. The other thing to remember is that what's on the kids menu and the foods that are bundled together into a kids meal are marketing in and of themselves, right? So it's the advertising, the toys, the websites, but the kid meal is a very powerful form of marketing. It's bundled together, it's priced at a lower price. We know that defaults have a big impact on what people eat. The data on defaults comes from a wide range of different fields: retirement plans, organ donation. There's lots and lots of evidence around defaults, and there's some evidence on defaults around food and even around children's meals. We know that defaults help to set people's expectation for what they should do and drive people in certain directions, and has the same effect with eating out. And unfortunately, restaurant kids meals are largely synonymous with unhealthy food. When you change that default, for example, this at the Disney theme parks, there's a very high acceptance rate for healthy defaults. It has an effect on the average calories of the meals that are chosen and what the kids are eating. At Disney, they found very high acceptance of the beverage default in particular. About 2/3 of families stuck with a healthier beverage as opposed to soda. Even though they could get a soda, they could order a soda for the same price, just having the bundling and around a healthier beverage helped to move families in a positive direction. So how much kids are consuming kids meals? It depends on the study. It's really focused more, kids meals are really for very young children, so the age group that we're talking about today. No self-respecting 10-year-old is going to get a kids meal, or rarely does, even though the price incentive is there for parents. This is really for kids in the age group that we're talking about. And one typical children's size beverage at a restaurant is enough to blow a kid's whole day's budget for sugary drinks. The American Heart Association recommends that kids get no more than 25 grams of sugar a day. One child-sized beverage would have about 33 grams of added sugars. Again, the American Heart Association recommends no more than one sugary drink per week for children, 1 8-ounce sugary drink, and a typical restaurant kids beverage ranges from about 6 to 12 ounces. So just one drink, that's their whole week's sugary drinks. So we've been approaching kids meals in two different directions: through public policy at the state and local level with communities around the country, and advocacy groups, especially Voices for Healthy Kids at the American Heart Association, who we've been partnering with, and then also by trying to get restaurants to do the right thing. So working with a number of partners, some of them in the room through the Food Marketing Work Group, we have encouraged restaurants to improve the nutritional quality of their kids' meals. And we're seeing some progress. The National Restaurant Association has its Kids Live Well program that's providing some technical assistance to restaurants to improve their kids' meals. We're having the most progress. We're making the most progress. So the overall kids' meals, there is some improvement, but it's really, really modest. The optimist in me would say we've tripled the number of healthy kids meals over the last handful of years, but that tripling went from 1% of the kids meals being healthy-ish, not even like super, super healthy, to 3%. So still the overwhelming majority of choices are unhealthy on children's menus, 97%. So on beverages, through a variety of actions, through email, letter writing campaigns, Twitter campaigns, shareholders actions, and others, members of the Food Marketing Work Group and other partners have convinced a number of the top restaurants to drop sugary drinks from the children's menu. But still, there are a lot of restaurants that need to make changes. We have this study coming out soon that's funded by Healthy Eating Research that shows that there has been progress in reducing sugary beverages on restaurant children's menus. It's gone from about over 90% in 2008 of the biggest chain restaurants having sugary drinks on the menu to now about 3/4. So it's moving in the right direction, but we still have a long way to go. Given the slow pace of change, many states and communities are moving to public policy as a way to change what's on the kids menu. The first two policies to pass were in Santa Clara County and San Francisco. Those policies have been framed as toy bans. I would ask you to never say that and frame those in that way. Again, that's a negative frame that's been used by the industry pretty effectively. What those kids' meal policies did was set nutrition standards for the kids' meals that come with toys. More recently, we've seen in Davis, Stockton, Paris, and again in Santa Clara County, policies that change the default beverages that can come with kids' meals. And so in most of those jurisdictions, Davis, Stockton, and Paris, it means that the default beverage that comes with a kid's meal needs to be a healthier beverage. Generally, it's unsweetened water and milk. Sometimes they're unflavored milk. Some allow juice, some don't. The beverage standards are a little bit different depending on the policy. In most of those communities, parents can still order a soda with the kids' meals if they want, except in Santa Clara County, where you can't even order a soda with the kids' meal. You have to pay extra and order that separately. So the kids' meal bills were controversial when we first started out in 2010. The last couple of policies have passed with much less controversy. In many of these communities, no restaurants even showed up to testify against the bill at all, which is terrific. The bill's passed unanimously, and so things have been moving in a positive direction. So I'll just point you to some resources. Changing the nutritional quality of kids' meals overall and getting sugary drinks out of them, like any policy, is not the magic bullet that is going to change everything, is going to cure obesity. But what this is one of the biggest types of marketing. It's a significant source of calories. And most importantly, we get away from training kids to eat badly when they're eating out. Right now, the social norm for kid food is that it's the worst food, right? It's pizza, cheeseburgers with a side of fries and a soda. And we see kid food often being the worst food out of a category, that companies are especially targeting kids with the worst food. We need to change that so kid food becomes synonymous with healthy food. So this is about marketing, this is about changing